Take place, permission speaker.
I invite the member for Richmond South Centre to lead the House in prayer or reflection.
Heavenly Father, as the events of the day unfold, we seek your guidance and your peace. We know that you are with us, and we ask you that you guide us in our deliberations today. May we be temperate and respectful of one another as we exchange ideas on how to make this blessed and rich land that we call home a better place for our fellow citizens. In Jesus' name, I pray, amen.
Introductions by members. Minister of Health.
Thank you very much, Honourable Speaker. Today I want to introduce guests, healthcare workers and guests from the Hospital Employees Union who will be joining us in the noon hour for a celebration of the passage of Bill 47. They're Mina Broussard, the Secretary Business Manager of the Hospital Employees Union, also Kaylee Frampton, Ronnie Nicolasera, Mike Old, and Maura Kerwin, Brenda Vandermeer from the HGU as well, Clarissa Hickap, who's a housekeeping worker, who is today a validator of the impact of Bill 47, and Cora Mojica, a food service worker, and many of these people will be familiar to you, Honourable Speaker, and to members of the House, and I ask you to ask everyone to make them welcome.
Member for Chilliwack.
Thank you, Mr. Speaker. I had a wonderful breakfast this morning with Kathy Clausen from the Shake and Shingle Bureau. Kathy and I share some friends. We also Kathy was born and raised in Chilliwack, and so we had a lovely discussion about shakes, shingles, and our value-added forestry industry. And she's in the gallery right now, so if everyone would please welcome Kathy.
Member for Delta South.
Thank you, Honourable Speaker. It's been quite 2 days in a row for me with guests from Tawasin, British Columbia, my beautiful riding of sunny Tawasin. And today I want to introduce a good friend, Shelley Davidson, who's here today, and she's brought 3 wild and crazy ladies with her, or 4 wild and crazy ladies with her, Kim Allen, Valerie Saka, Lynn Burns, and Anna Lesko. They're going to be touring the facility this afternoon, so please make them all feel welcome.
Member for Nelson Creston.
Thank you, Speaker. So I do think I might rival you for having incredible and wild, crazy ladies here today. I have my 2 CAs, but also my dear friend, Kelly Coulter. Kelly brought me to Ottawa to lobby, we weren't even lobbying, we were activists, and it changed my life. She is the reason I entered politics. She has supported me through the entire process. She's been my rock here in Victoria when I didn't know anyone. I love you, Kelly. And she is also the woman that convinced Justin Trudeau to legalize cannabis. So I can't ask for a collective whoop whoop, but I would like to say, Kelly Coulter, I love you, and I'm so happy you're here today. Thank you, Kelly.
Member for Abbotsford West.
Thanks, Mr. Speaker. Kathy Clausen has spent a lifetime in the shake and shingle industry. Today she continues to operate her own business. She is also the head of the Cedar Shake and Shingle sector. I know members will want to welcome her to Victoria and the precincts, but she is here because Cedar Shake and Shingle business is facing some serious challenges, and I hope in addition to welcoming her that members will take a moment to learn more about the challenges facing that sector of the forest industry. It is difficult to make a cedar shake and shingle without access to the fiber. Please make Kathy welcome.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. I stand today to wish a number of birthdays in my family. I announced in a secret last year about a little treasure that was coming to join us, and I'm very pleased to say he was born on December 1st, and his first birthday is coming up. So happy birthday to Beckett. I also have a granddaughter who is having a birthday, to Maggie Ray, and also share with Burnaby North, my son-in-law, her nephew, who is turning the big 5-0 today. So happy birthday to all those people in my family. And the secret now is baby Beckett is having a brother or sister. So thank you.
Madam Clerk.
Introduction of bills. Statements by members.
Member for Surrey South.
Thank you, Mr. Speaker. Tomorrow, November 25th, is the International Day for the Elimination of Violence Against Women, officially designated by the adoption of a United Nations resolution in February of 2000. And tomorrow also marks the beginning of 16 days of action against gender-based violence. Women's rights activists have observed November 25th as a day against gender-based violence since 1981. The date was selected to honor the Mirabal sisters, 3 political activists from the Dominican Republic who were brutally murdered in 1960 by the country's violent dictator. Despite decades of activism, violence against women and girls remains a pervasive problem worldwide. To date, only 2 of 3 countries have outlawed domestic violence, while 37 countries worldwide still exempt rape perpetrators from prosecution if they are married to or will eventually marry the victim. And 49 countries currently have no laws protecting women from domestic violence. In Canada, we have laws against domestic violence. Our Charter of Rights and Freedoms codifies the rights of women under Canadian laws and statutes. Yet even with all our legal protections, violence against women continues to be a serious problem in Canada. While significant efforts have been made in recent decades, much work remains to be done to prevent and respond to the violence that persists in both public and private spheres of women's lives. According to national statistics, women are more likely than men to be the victims of specific forms of violence, such as intimate partner violence, severe forms of spousal violence, sexual violence, and stalking. Tragically, the actual incidence of violent acts against women and girls is estimated to be much higher than official statistics suggest, as a large percentage of this violence goes unreported. So today, as we mark the International Day for the Elimination of Violence Against Women, I hope each member of this chamber will join me in not only raising awareness, but also to act. Let us empower women and girls and continue to do the important work in this House required to support them and to protect them. Thank you.
Member for Richmond South Centre.
Thank you, Honourable Speaker, and I'm going to be joining the previous member and also echoing her comment as well. November 25th is the UN-recognized International Day for the elimination of violence against women and the start of a 16-day of activism against gender-based violence. The campaign runs until December 10th, which is International Day of Human Rights. Gender-based and sexualized violence too often impact women, girls, two-spirit, transgender, non-binary, and other gender-diverse people with devastating and long-lasting impact. In our province, gender-based violence is also complicated by numerous barriers and stigma. And unfortunately, gender-based violence still exists today. Our provincial government is committed to helping and end gender-based violence, and we partner with community organizations, advocacy groups, sexual assault centers, victim services, and transition houses to support victims and their communities with professional care and compassionate support. Some actions of our government has taken so far: provide paid leave for people facing domestic violence, sexual violence, undertake consultation regarding the non-consensual disclosure of intimate image. Starting next year, an additional $10 million annually will be provided to establish stable funding for sexual assault centers. We're providing annual funding to support 400 victim services and violence against women program across the province. Our government is also investing $734 million over 10 years to build and operate 1,500 transition housing, second-stage housing, and long-term housing spaces for women and children fleeing violence. If you know someone you know is being abused, or if you have concerns about someone's safety, please call or text Victim Link BC through its toll-free number 24/7, confidential, multilingual telephone services at 1-800-563-0808 or by email victimlinkbc@bc211.ca. Anyone who is in danger should call 911. Ending gender-based violence will require all of us working together. Thank you, Mr. Speaker.
Member for Caribou-Chilcotin.
Thank you, Mr. Speaker. Born in Sweden in 1922 as one of 4 children, Rudy has certainly lived a rich and full life. In 1931, Rudy's family immigrated to Canada. In 1934, he turned his mind to business at the ripe old age of 12 when he started his first firewood business in Matsqui. And in 1937, he ventured into the logging industry. After knowing the love of his life for 3 years, the couple were married in 1943 and celebrated 77 years together before the sad passing of Helen in 2021. In 1947, the couple moved their family to Williams Lake, where they took on many businesses, including relocating houses, churches, and other buildings, along with owning the Beaver Valley Sawmill. As if they weren't busy enough already, they started Chilcotin Airways and bought the Valley View Motel, built 6 bowling alleys throughout British Columbia, and then purchased the Buckskin Ranch west of Fraser River near Soda Creek. One day, while helping a ferry operator, his wife Helen fell in the Fraser River and nearly drowned. Rudy, being Rudy, said it's time for a bridge, and off he set to build one. After purchasing a bridge in Alaska and bringing it to its current location, even after being told it could not be done, he opened the bridge in 1968 and sold it to the government of BC 10 years later. Rudy Johnson's bridge is still a crucial access to residents, ranchers, and loggers. Not sitting idle, he accomplished so much more in his life, including building the co-op feed store in Williams Lake and building a road building business with his son Gary. He was the president and director for BC Livestock. A long-time friendship with past MLA Alex Fraser has always kept Rudy active politically. I'm proud to share the incredible life story of Rudy Johnson with this House today and ask, Mr. Speaker, that you and this whole House join me in sending this British Columbia champion and Caribou Chilcotin icon, Rudy Johnson, the happiest of 100th birthdays from all of us here in the Legislature.
Member for Chilliwack.
Thank you, Mr. Speaker. I'm speaking today to Indigenous Disability Awareness Month and the United Nations International Day of Persons with Disabilities. November is the 8th anniversary of the Indigenous Disability Awareness Month here in British Columbia. This Awareness Month was created by the British Columbia Aboriginal Network on Disability Society, or BCANS, in 2015 and is now recognized by hundreds of Indigenous and non-Indigenous communities and organizations across Canada. Thanks to BCANS, BC is leading the way in recognizing, raising awareness, and celebrating the contributions of Indigenous peoples with disabilities. Indigenous people with disabilities often face additional barriers, such as limited employment opportunities. I'd like to thank BCANS for being an essential partner in advocating for Indigenous people for the past 30 years. On December 3rd, we recognize the 30th anniversary of the UN International Day of Persons with Disabilities. While there are over 926,000 people in BC living with a disability, there are over 1 billion worldwide, or 1 in 7. This day brings worldwide focus to the contributions and successes of people with disabilities. This year's theme is Transformative Solutions for Inclusive Development, the role of innovation in fueling an accessible and equitable world. This is especially meaningful here in BC. We're fortunate to have so many organizations in BC dedicated to supporting people with disabilities and working to break down long-standing and systemic barriers to accessibility. We're pleased to support such organizations and help them advance accessibility and inclusion in their communities. For our part, we are hard at work to build a barrier-free BC, a province with communities and workplaces that are truly accessible and inclusive. I congratulate those around the province for their contributions that help make BC a welcoming place to call home. We want all people in our province to feel supported, and we will continue to invest in programs that help Indigenous peoples and peoples with disabilities thrive and succeed. Thank you, Mr. Speaker.
Leader of the third party.
I've been thinking a lot lately about dreaming big. None of us came into this world we're in, into this chamber, without big dreams, without a vision for what we could do. It's the belief that we can make real change that propels us through the late nights and long days, the time away from our families and loved ones. And I'm sure that each of us can think of the organizations and the people who inspire us to dream big, who make us believe that anything is possible, that we can imagine a world that is fair, a world of generosity and kindness, a world of hope, a world of abundance and love. For me, one of these people is Stephanie Allen. Stephanie is a founding board member of Hogan's Alley Society, a society that has not only restored the history, memory, and celebration of Vancouver's vibrant Black community that was displaced by the construction of the viaducts, but that has a vision for a future of this area, created in collaboration with racialized and marginalized communities that captures what is possible when we refuse to let our imaginations be confined and constrained. I believe that all of us can celebrate and embrace a vision where everyone is housed, there's food on the table, and people are living in caring, connected communities. We have so much collective agency, but we get trapped in stories that are rooted in separation rather than connection, stories that tell us that for one person to get ahead, others must fall behind. Public health care, public education, non-market housing, libraries, parks, so much of what we know are the elements that make our neighborhoods, communities, and societies truly vibrant and rich. These aren't manifestations of unfettered capitalism. They're a buffer against it, recognizing that not all wealth is measured in dollars and GDP. Let us remember and celebrate the voices and visions of women like Stephanie Allen, who remind us to dream big.
Member for Surrey Panorama.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. As I rise in the House today, I'm often amazed at the times that we can all come together from both sides of the House and take action that benefits British Columbians. We did that 4 years ago today when we passed Bill 47, the Health Sector Statutes Repeal Act, to undo Bill 29, which was passed in 2002, showing that elections matter and governments matter. That bill had led to the privatization of services and had seen thousands of jobs contracted out to for-profit multinational corporations. Thousands of workers lost their jobs, and the rest saw their wages cut drastically, often reduced to minimum wage. This legislation was repealed by all of us, setting the stage for the repatriation of thousands of healthcare workers, 4,601 food service and housekeeping staff. Many of us have been present as thousands of workers have been brought back into healthcare authorities. The tearful and emotional stories that every one of us have heard have been touching and teary for us as well. Thanks to Bill 47, thousands of healthcare workers returned home. They returned home to stable jobs with improved pay, job security, and better working conditions. They are valued. The patients in our hospitals and care homes and their families across the province benefit because of improved care. Thank you to the health authorities and Providence Healthcare who have worked with government to enable repatriation. Repatriation, dictionary definition, the procedure through which the government brings an individual residing in a foreign country home. To all healthcare workers who have been repatriated, welcome home. Today's celebration, however, could not have been a reality without the tenacity, the commitment, and dedication of the Hospital Employees Union. For 20 years, HEU members have campaigned to have their family reunited under one roof. Welcome home.
Madam Clerk.
Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Mr. Speaker, our healthcare system staggers from crisis to crisis to crisis. And during this new Premier's 4-month tainted leadership race, not once did we hear a single policy with respect to healthcare. Not once, Mr. Speaker. Our healthcare system in British Columbia was once recognized as one of the best in the country. Today, it ranks amongst the very bottom. 1 in 5 British Columbians who cannot access a family physician. Cancer care wait times among the very worst in the country. Our hospitals, our emergency departments are in total chaos with wait times, young parents worried about their young children, spending up to 15 hours in emergency departments trying to get urgently needed care. Hospitals in Surrey, here on the island, in Vancouver, and right across the province are overrun, and we've got 6 sick children that are being treated and resuscitated in hallways. It is worse than hallway medicine. It's literally hallway CPR. Now, Mr. Speaker, leadership means having the ability to make tough decisions. And once again, I want to ask the new Premier. He now has an opportunity. We've asked the Health Minister repeatedly to do the right thing and resign so that we can get someone in here that knows how to fix problems. Will this Premier do the right thing, fire his Health Minister, and make sure we get someone in there that knows how to fix problems and improve the healthcare system in British Columbia?
Premier.
Thank you. The member's right that our healthcare system is under incredible stress. Healthcare workers have gone through the pandemic. They've worked extended hours. We have a very significant flu and respiratory virus season that we're seeing having impacts across Canada. Actually, it was just this morning. I was on a call with premiers across Canada, leaders of the territories, talking about the challenges that they face in their provinces and territories as well around healthcare and how we're all going to work together with the federal government to address this critically important issue for families. I can't imagine the feeling as a parent going to a hospital when the care is not there when you need it, when you expect it for your own kid. This is a priority for our government. Talked about housing, talked about public safety, talked about a strong economy, but healthcare is foundational for British Columbians. And we have taken important steps. The health minister has taken important steps. You saw recently the agreement with family doctors to get increased access to family doctors for British Columbians. You saw expansions at UBC and the Faculty of Medicine to train more people. You saw that we brought healthcare workers back into the system and hired thousands and thousands more to address this strain. 602 new nurse training seats, fast-track credential recognition. Speaker, the work is not done. We've got a lot more to do.
Leader of the Official Opposition, supplemental.
Thank you, Mr. Speaker. Well, boy, do you ever have a lot more to do. I've been a health minister. I can tell you. Oh, this.
Members. Let's check the outcomes. Leader of the Official Opposition has the floor.
Thank you, Mr. Speaker. I've been a health minister when our health system was considered the top in the country. But I also know, Mr. Speaker, that the healthcare system is a tough portfolio. And I know, Mr. Speaker, that while I was health minister, we saw challenges too. There was H1N1, there was SARS, there's always going to be stresses on the system. But never have we seen a situation where even the current Premier's predecessor described our system correctly as crumbling. It is imploding upon itself. And there is such a massive gap between their lack of understanding that announcements are not outcomes. Making announcements does not produce a better outcome. We are getting terrible outcomes in virtually every measurement in the healthcare system, Mr. Premier. In cancer care, we hear devastating stories of wait times that are some of the worst in the country. They've ballooned from weeks to months, and it has real life impacts. A young man in his 40s, diagnosed with pancreatic cancer, waiting 8 weeks for his first consultation, and dying only 3 days later. We hear of women with urgent gynecological cancers who can't get appointments scheduled until March of next year, virtually guaranteeing that these cancers will progress and in some cases will become incurable. And we've heard the story in this legislature of Feyra Kruger, a retired nurse from White Rock who was diagnosed with skin cancer and has endured 8 weeks waiting on a wait list. A retired nurse who spent her life helping others, now having the system let her down. Since I raised Feyra's case 3 weeks ago, things have gotten a lot worse, and doctors have now told her she will likely lose her ear, part of her jawbone, facial mobility, and her sense of smell and taste. Delays and cancer wait lists mean that Feyre now faces permanent disfigurement, and the system has completely failed her. And so many others. Sadly, in many cases, that will be individuals that lose their lives. Will this Premier recognize that the healthcare system needs leadership? Leadership that can focus on outcomes, that is paying attention to the right things that we have to focus on, measuring those outcomes, holding people accountable, making sure that if we're not getting improved results, that people are being removed, changes are being made, so that we can get the improved outcomes that British Columbians deserve. Will the Premier do this?
Premier.
Honourable Speaker, if someone has a diagnosis of cancer, they shouldn't have to wait for the care they need. And I agree with the member this far. It is unacceptable to have people waiting for cancer care like that. We are investing in diagnostic equipment across the province. We're investing $10.1 million to hire 25 new oncology physicians. We increased BC Cancer's base funding by $41 million to expand services. These are all very serious issues, Honourable Speaker. I wasn't going to raise it, but the member raised his record. I will mention as health minister in 2009, he forced health authorities to absorb $360 million in cuts.
Member for Prince George Valemount.
Thank you very much. And the Premier may want to be careful with his words in this House, because one thing I can assure him of, the budget for healthcare went up every single year that this side of the House was in government. And let's be clear, the Premier is out making a blizzard of announcements and pouring money into areas that he's trying to fix after he had those files for more than 6 years, and at the same time has failed to make a single comment on the state of healthcare in British Columbia. Meanwhile, the crisis has gotten worse, and it's so bad that families who arrive at BC Children's Hospital with a sick child, and I do know the Premier can understand what that might feel like, they need urgent care. They are waiting up to 12 hours for that care. Not acceptable. Other families are dealing with the trauma of cancelled surgeries, like the parents of Nash. Nash is 6 months old, and the optimal time to have his surgery is right now. But last week, the Premier may be interested to know that his heart surgery was cancelled in British Columbia under this minister's watch. His father said, and I quote, "Obviously we think of how long can we delay the surgery without having long-lasting impacts on him, and also for the other families that are in exactly the same situation. More than ever, it is time for a change in direction, and the Premier now has the opportunity to do that. Will the Premier do the responsible thing, fire as health minister, and find somebody who is going to pay attention to the outcomes that matter for British Columbia's families?"
Minister of Health.
Thank you very much, Honourable Speaker. Thank you to the member for her question. When surgeries are delayed, I know as Minister of Health, everyone in the health system takes the matter exceptionally seriously. In March of 2020, we delayed effectively 30,000 surgeries. And our commitment in surgical renewal was to make that up, and we did. 99% of them completed, Honourable Speaker. In a pandemic year, because of surgical renewal, because of the 300 new surgical nurses that we hired, because, Honourable Speaker, of the 70 new device processing technologists that we hired, we were able to complete record numbers of surgeries. In fact, Honourable Speaker, in the last 2 weeks in October, we did more surgeries in British Columbia in some of the most challenging circumstances than has ever been done before. Now, Honourable Speaker, when you're facing a pandemic and the challenges of dealing with influenza and RSV and other conditions, especially for children right now, you do have to adapt in the healthcare system to respond to that. And we're doing that. That's why we prepared in September for what is going to be an exceptionally difficult fall. We've made preparations, as we did in 2021, as we did in 2020. And yes, Honourable Speaker, in 2021, for example, we delayed a lot of surgeries in the Northern Health Authority and mobilized to bring 160 people in critical care down to the southern part of the province. Yes, we did that, because that's preparation and that's action, and that's what we're going to continue to do.
Prince George Wilmot supplemental.
Well, the minister can talk about those surgeries, but his words mean very little to Nash's family. They have a 6-year-old child whose heart surgery has been delayed, and that's not the only surgery that's been delayed, and it's not the only situation that families are facing. The minister knows outcomes matter, and currently for British Columbians, many British Columbians, they are afraid that if they get sick, they are not going to get the care they need in this province, and that is unacceptable in the province of British Columbia. I'll just share one other story of the many, many, many that I know the minister hears about too. Let's talk about Rachel Thexton's story. Her 5-year-old son had pneumonia, and her 2-year-old daughter, Naya, had been sick with a fever for nearly a week. She first tried to go to BC Children's Hospital, but it was obvious that they were completely overwhelmed. So what did she do? Desperate mother, 2 children. She turned around and went back to her home in community of Burnaby to another completely overwhelmed emergency waiting room. And at 4 a.m., her sick 2-year-old just begged her mom to go home. Here's what Rachel had to say to the minister. During this entire time, we're at 6+ hours. There was no communication. No one came in, talked to her, or even looked at her, or took her temperature, end quote. So they left the ER and went home. Those are the stories of British Columbians. Those are the outcomes that this minister stands up and chooses to ignore every single day. For the minister, it's time for him to do the right thing. It is time for him to resign, to step down, and for the Premier to stand up and make sure that someone's in charge who cares about outcomes for British Columbians in this province.
Minister of Health.
Honourable Speaker, I would say, as a Minister of Health and as a person in BC, I care about every single case. And members of this House know I care about every single case. When cases come to my attention, and they do every day, we provide all the support we can. We have gone through a period in every health system in the world that is without precedent. And British Columbia, as a province, because we came together, including, let me say, members of the opposition, we came together and did exceptional things together on surgeries, on diagnostics, on response to COVID-19, on one region of the province supporting other regions of the province, in preparing for some of the most difficult challenges we've ever faced. The staff at BC Children's Hospitals and in BC pediatric units around British Columbia are doing exceptional work right now. And we are taking every step we can to support them. And, Honourable Speaker, and I say this to everybody in the House, we are also standing up the largest immunization program in the history of British Columbia, the largest in the history. We are going to have more people immunized against influenza this year than ever before, in the midst of a healthcare crisis. And, Honourable Speaker, 1.5 million so far immunized with a bivalent COVID-19 vaccine. But I say to everybody, it's time to book your vaccination. This is an important time. Honourable Speaker, the opposition may moan. This is a critical thing for people to do. The influenza is preventable. Right now, as we say, largest campaign in history, about less than 20% of children are immunized against influenza. Book our appointments today and let's all get immunized.
Leader of the third party.
Thank you, Honourable Speaker. My question is to the Premier. Is he in favour of the rise of for-profit corporate healthcare delivery in British Columbia?
Minister of Health.
Thank you, Honourable Speaker. The answer is no. And that's why we have Hospital Employees Union members in this House today who have seen what we did to repatriate contracts throughout the healthcare system. That's why in communities such as Dawson Creek, communities such as Terrace, communities such as Williams Lake, communities around British Columbia, communities such as Surrey, communities such as North Vancouver, we're building health capital projects that are not P3s, that are owned by the people of British Columbia. That's why we work together with our province's doctors to change the way we paid doctors in BC, working together to ensure that that payment reflects the work done, it reflects the care patients need, why we have continued to take steps, dozens of steps, to ensure a stronger public health care system and to work against, Honourable Speaker, the increasing privatization of the system, which is not good news for anyone. It's why we purchase private MRI machines. It's why we purchase private surgical centres. Why we've seen the largest, Honourable Speaker, increase in, Honourable Speaker, no staff. Honourable Speaker, they're yelling no staff. We did more surgeries in the last 2 weeks than we've ever done before, Honourable Speaker, in the public sector. And it's why we changed. Thank you.
Members.
Honourable Speaker, with respect to the Medicare Protection Act, we brought in regulations. We proclaim regulations that have been left unproclaimed for 15 years to strengthen the protection of public health care as well. And we're going to continue to do it.
Leader of third party supplemental.
Thank you, Honourable Speaker. Well, regulations to this government, whether it's regulations in environmental protection or regulations in healthcare protection, seem to amount to the same thing. Not much at all. We've heard over and over again from the minister. But my question was to the Premier, because under this government's watch, let's look at what's happening. Two-tier health care has been on the rise. While family doctors burn out in record numbers, some are choosing to charge for their services. TELUS Health is charging upwards of $3,000 a year for access to health care, including access to a family doctor. We've been asking this minister about this since February, and it's always the report's coming, the report's coming. Shoal Health charges $2,400 a year. Beta Therapeutics charges $110 a month. More and more for-profit corporate clinics are popping up, and yet nothing has been done. Universal health care was a foundational principle of the NDP in Canada. One wonders what Tommy Douglas and Dave Barrett would have to say about the conditions under an NDP government in BC today. My question is to the Premier. Will he stand up and tell British Columbians his position on for-profit, two-tiered healthcare in British Columbia, and whether that is the future that he sees for this province?
Shh. Members. 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 Minister of Health.
Honourable Speaker, I'm opposed to extra billing for medically necessary services, and the Medical Services Commission has been taking action again and again and again to deal with it. They are dealing as well with the telehealth issue, Honourable Speaker, which I, Honourable Speaker, referred to them because I take that issue so seriously. It's why we are in, Honourable Speaker, a province of laws, which means the Medicare Protection Act in these matters is enforced by the Medical Services Commission. And, Honourable Speaker, no one would want it any other way, Honourable Speaker. But what we're doing, Honourable Speaker, in particular in important ways, is, Honourable Speaker, to improve the public healthcare system. In particular, Honourable Speaker, in services that people used to have to go and get private care for. When under the previous government, we only did 174,000 MRIs in 2016-17, Honourable Speaker, what that meant for people is they had to go and get private care, pay for care that they should have been getting in the public system. And that is why, Honourable Speaker, we increased the number of MRIs in the public system by 120,000, purchased private MRIs, and improved care for British Columbia. And we're going to continue.
Member for Nechako Lakes.
Thank you, Mr. Speaker. And I had a different question planned for today, but given the topic, I think it's appropriate to stay on the topic of health. In my riding, we have seen similar health problems as we've heard now from the opposition. And I have to say, it was back under Gordon Campbell when he said that the issue of mental health, but in particular the issue of dementia alone, would sink the healthcare system. And the toughest job would be the Minister of Finance to be able to provide enough funding for the system. And unfortunately, through the years, we haven't seen a lot of changes. Across Canada in 2020-2021, more than 26,000 people died on the waiting list for diagnostic or surgical services. In Fraser Health, that number was about 321 people that died waiting for those services. We have a healthcare system, quite frankly, that is in crisis. We have a system that is not meeting the needs of the people in this province, whether that's in rural BC or whether that's in urban BC. And the challenge, quite frankly, I see when this came to court just this summer, was the government basically argued that the system was more important than patient outcomes. And that was with a case against Brian Day and his surgical centre that came out. So the question through the Minister, through you, Honourable Chair, is when are we going to be looking at a system that works in other jurisdictions rather than focused on a system that, quite frankly, is falling under its own weight?
Minister of Health.
Well, thank to the member for his question. I just note that Dr. Day brought a case against the government and the people of BC, not the other way around, and that successive governments defended the province of BC and the public healthcare system against that. And I was very happy that that case was won. It's now on appeal. That's with respect to Dr. Day's case. The important fact, I think, for people in rural BC, because you do not see, Honourable Speaker, in the Northern Health Authority, the same development or for-profit, for example, long-term care or anything else in other jurisdictions. The public healthcare system doesn't. And we made important changes, and the member will know this in his riding, that sometimes it requires, yes, political will to invest. And that's why we're building a new hospital in his riding. There was a temporary hospital, he knows, built in 1972, a temporary modular hospital that should have been replaced in 1982. And we waited decades under successive governments, let's say, for that hospital to be built. It's being built now. And that allows us to recruit. And it will be owned by the people of BC, and services will be delivered by the outstanding healthcare staff of the region.
Thank you, Minister.
And we need to continue to make those kind of investments to ensure that there's care everywhere in the province, not just in urban areas.
Member for Nechako Lakes supplemental.
Thank you, Honourable Chair, and I want to thank the Minister for his response. And we're very appreciative of the hospital that will be built. The current hospital is undiverted. The current hospital is on diversion almost half the time, and there's only 3 doctors remaining in Fort St. James at the moment. In addition, the new hospital will need about 8 doctors, and there is no staffing plan. But regardless of that, a recent report showed that our healthcare system is the second most expensive in the world for universal healthcare. Yet we are almost dead last on doctors per patient, beds per patient, as well as wait times, particularly within the critical windows. Our system is broken. We need to be looking at models that are working in other jurisdictions in the world. And the previous Premier and Health Minister has gone to Ottawa and said, you know, we need Ottawa to put more money into the system. Well, there is only one taxpayer. Whether it comes through Ottawa and then gets wasted, you know, before it gets to us, or whether it comes from us, there is only one taxpayer. We have a system that is expensive, and we need to see a system that has real meaningful change. European jurisdictions don't have these problems.
Member, can we have a question, please?
Why are we not looking at their model and trying to learn from it to get a healthcare system in British Columbia that can actually meet the needs of people in this province?
Minister of Health.
Thank the member for his thoughtful question. Honourable Speaker, respectfully, BC has, in terms of its administrative costs, one of the most efficient healthcare systems in the country. I believe, Honourable Speaker, that we have to make investments, particularly in the communities, particularly in rural communities, to support primary care in the future. We had gone from 300,000 people who had a family doctor in 2003 to 908,000 people who had a family doctor in 2017. And that trend, because of COVID-19 largely, has picked up again now. And so we have to take action to address that, to transform the system. We have just designed and worked on and signed with the doctors of BC a transformational agreement that in particular will help people in the member's constituency, Honourable Speaker. We have, the member talks about dementia, in long-term care, Honourable Speaker, gone from the worst record in Canada, Honourable Speaker, the worst record in Canada under previous ministers of health, I won't name them, Honourable Speaker, I won't name them, Honourable Speaker, to meeting provincial standards, Honourable Speaker, by investing in more staff in the community, Honourable Speaker. And since the 2020 election, when we promised 7,000 new staff in long-term care for infection control and to support long-term care residents, we have delivered more than 7,000, Honourable Speaker, in this short period of time.
Opposition House Leader.
Thank you, Mr. Speaker. Well, this last week has been full of revelations about a variety of topics that are undoubtedly shocking to British Columbians. A particular theme has been a series of audits and reviews related to the mess at BC Housing and Atira. Some of these audits reviews have been leaked by whistleblowers, some have been buried by government, and others are mysteriously apparently underway. As important as it is to look to the future, it's equally important to examine the past performance of government, and for that we have to thank the tireless work of the Public Accounts Committee. So my question today is actually to the Chair of the Public Accounts Committee. Can the Chair of the Public Accounts Committee tell us what is on the agenda of the committee and if it relates to the pressing and important matters facing the people of British Columbia today?
Member for Kamloops North Thompson. Members will come to order.
Well, thank you, Mr. Speaker. A guy could get used to this. Mr. Speaker, the Public Accounts Committee actually does have a quite lengthy meeting scheduled. We just finished finalizing that. It was originally supposed to be a 3-hour meeting on February 1st to go over the Auditor General's 3-year rolling average fiscal plans that he plans to bring forward to the committee to review and investigate. But we also have reached out to the Office of the Comptroller General for that meeting, so we've extended it to a 6-hour meeting as well. Because both the Auditor General and the Comptroller General provide feedback, valuable feedback on the scrutiny of what's going on with spending within British Columbia. So we've asked for updates on the grizzly bear management plan, the commercial vehicle safety audit, as well as the detection and response of cybersecurity threats to BC Hydro industrial control systems. But Mr. Speaker, I would anticipate on that agenda in discussion phase with the Auditor General and with the Comptroller General, given the revelation from the Premier yesterday, unlike the Housing Minister on Tuesday, that there is in fact a forensic audit underway of BC Housing. I would fully expect that the Public Accounts Committee will be engaged with that audit as it finalizes and have the opportunity to scrutinize that audit with the Comptroller General, the Auditor General, and BC Housing, much as we've done in the past with BC Housing, the Auditor General, and the Comptroller General. So we do look forward to the previously unannounced or no notice to that forensic audit coming forward. So thank you, Mr. Speaker.
The bell ends the question period. Member for West Vancouver Capilano.
Thank you, Mr. Speaker. I rise on a point of privilege, having reserved my right yesterday at the termination of question period, that being my earliest opportunity. The point of privilege concerns statements made yesterday, November 22nd, in question period by the Minister of Children and Youth in response to a question put to the Minister by the member of Saanich North and the Islands regarding ending the individualized funding model for children with autism and replacing it with a hub model. Yesterday, the Minister of Children and Family Development stated, quote, "There was a select standing committee of this very legislative assembly that made the recommendation that we need to move towards a need-based system," unquote. Mr. Speaker, this is a statement that the Minister has made before on multiple occasions. I have the privilege of being a member of a select standing committee on children and youth and that committee undertook a special project on children and youth with neurodiverse special needs with a focus on eligibility and assessment processes. On October 30th, 2019, the committee released its report, making 16 recommendations. The report has these 16 recommendations, which are available for anyone to read. And Mr. Speaker, it is clear that not one of these recommends a needs-based system. As a current member of the committee, I can also confirm that outside of this 2019 report, there has been no further recommendation made on a needs-based system. It's demonstrably inaccurate to claim that the committee made any such recommendation to move to a needs-only based approach to provide services to neurodiverse children. It did not happen, and the Minister was well aware of this. I am calling on her to retract these purposely erroneous statements and correct the record. To substantiate my assertions, Mr. Speaker, I'm pleased to table the 2019 report.
Does the Minister like to make a submission, or if not, the Chair will take it under advisement?
Thank you, Honourable Speaker. I will deal with this at a later time.
Thank you. Opposition House Leader.
Thank you, Mr. Speaker. I rise to seek leave to motion 24, standing in my name on the order paper, which amends Standing Order 81.1, the intent being to preclude the deplorable and precedent-setting use of time allocation by government as witnessed in the House earlier this week.
Shall it be granted? Leave is not granted. Madam Clerk. Leave was not granted. Yes. Government House Leader. Sorry, Madam Clerk.
Orders of the day.
Government House Leader.
Thank you. Actually, no. Not yet. Anyway, in this, thank you, honorable Speaker. In this chamber, I called continued committee in the whole on Bill 43, Housing Supply Act. In the Douglas Fur Room, I called continued committee debate on Bill 38, Indigenous Self-Government Act. And in the Birch Room Committee C, I call continued committee the whole debate on Bill 36, Health Professions Act.
Committee chairs.
We'll call a short recess as people get prepared. Order on the order paper is Bill 43, Housing Supply Act. We are on Clause 17. Shall Clause 17 pass? Member, Peace River South.
Thank you, Madam Chair, and welcome to the Minister and his staff. I hope they had a good night's rest after a long day yesterday. I can foreshadow that we won't be here till 10 o'clock tonight as we discuss this bill, and I know we're getting very near to the end, but I want to again just acknowledge the work that was done by Minister's staff yesterday. As it was a long day, but we moved through this, and it's very important when we're talking about the housing crisis that we have in the province of British Columbia right now, and the work that's trying to be put forward to try to, I guess, put an end to it, I guess, would be the commentary that the Minister and I could agree on this one. In Section 17, we were talking about basically judicial review, judicial orders and that. This is something, obviously, that the minister has a lot more expertise in a lot of ways than I do. We did canvass it a little bit yesterday in talking about what would constitute, I guess, moving forward, depending on whether things were patently unreasonable and the determination around that on a judicial review. And I'm just kind of curious, though, from the minister's, when the minister looks at this, the legalese around this and around setting thresholds. We talked about that an order would already be made, it would be going to a judicial review before it would be considered whether it was patently unreasonable or not, if I understood what the minister was talking about yesterday. But how do we determine the threshold of what's considered unreasonable, and could those thresholds be low? I'm curious if you could have political shenanigans that could take place when we look at setting criteria. So I'm just looking for some reassurance and maybe a bit of a discussion on this to give assurances, I guess, when we talk about setting the criteria of what's patently unreasonable and how would that all be considered through a court system.
Minister.
Well, thank you very much, and I'd like to thank the Honourable Member for Peace River South and the Housing Critic for the official opposition for his kind remarks about my team, and I'm grateful for him pointing out the hard work that they've done. On the specific Section 17 issue on judicial review, just as a backgrounder, the courts have the inherent jurisdiction when a judicial review application is brought to them at the threshold to determine what the standard of review should be. And that would happen in any case involving any statutory power of decision. Later today, we're going to be debating the Judicial Review Procedure Act amendments, and that is a statute that is at the core of what the member is referring to. But we have in British Columbia, under the former government, passed a statute that tried to clarify just when a particular set of decisions would be subject to what standard of review, namely the Administrative Tribunals Act. What this bill has done, as is typical increasingly, is to say to the courts and to the people who might litigate any kind of decision made, here's a standard of review that is appropriate for this kind of a decision. It's not left to the courts. The courts have to decide just whether or not it's appropriate and applicable, but rather than letting them start at the outset to make that determination on their own, the legislature would say to them that certain of those decisions would only be open to successful judicial review if the court initially concludes that they are either correct or not, or patently unreasonable or not. And it's also gone to suggest the kind of things that would be subject to patently unreasonable discretionary decisions, such as exercising a power arbitrarily or in bad faith or for an improper purpose, or predominantly irrelevant factors being taken into account, or failing to meet a particular statutory requirement. So the purpose of the legislation is to provide guidance at the back end, as it were, Mr. Speaker. So when a particular decision, housing target review, a progress report, an order in council, a directive, whatever it is, the courts have guidance as to what standard they should apply when it gets to them. And then, of course, they'll apply that standard and find out whether there's been an error that warrants their overturning or the decision, or frequently they send it back for reconsideration. And they have a number of remedies available, both under the Judicial Review Procedure Act or at common law.
Member.
Thank you, Chair, and thank you to the Minister. I mean, we want to spend a little bit of time on this because, of course, this is something that, in the context of this bill, of a Housing Supply Act, I know, as the Minister alluded to, will be other discussions on judicial review later, but when it comes to the discussion that we're having around this specific bill, of course, just to backtrack a little bit after the long day yesterday, of course, we were talking about the bill bringing in the requirement for municipalities to set targets, and then we talked about how, if those targets, how they will be audited, we'll use that word, I guess, or reviewed then through annual submissions for them to be looked at, then the opportunity for the minister to appoint an auditor to come in and to look at what was taking place and an advisor to support them if they're not meeting targets. We talked about all of that yesterday. One of the questions that came to me yesterday after our debate from a local government that I wanted to make sure that we get this, the clarity around it, is who's asking for the judicial review and the situation that might rise for the requirement of a judicial review. Is that being initiated by a local government who is not in agreement with the minister or ministries and government's decisions? Or would it be a judicial review based on the ministry then going after a local government for not implementing an order? Maybe the minister could spend a little time just giving some examples of so local governments that have contacted me understand the purpose of why this is part of a Housing Supply Act.
Minister.
Thank you, and I appreciate the question very much, Madam Speaker. The bill does not contain an appeal. Many statutes do, and then it's quite straightforward. The legislation can say who has what the courts call standing, who has the ability to bring that appeal is very explicit in the bill. But this bill is subject to normal judicial review, which goes back to frankly, to the Middle Ages, well, at least into 1700s in England, and we've taken our law in Canada from that tradition. And so, to the member's question specifically, who has standing, who would have the ability to bring a judicial review, is really in the court's hands. So, for example, if a ratepayer were to come forward and say, I don't like this decision or that order, or shouldn't have done that directive, or whatever, the first question the court has to determine, after the standard of review piece we discussed, is does this person have standing? And I can assure the member that there are thousands of cases at the Supreme Court and elsewhere that answer that question, who has standing? Would a local government have standing? I can't give you an answer because it would depend on the issue and what the court would say. But would a local government have the ability to seek judicial review? I would have thought so. Would a ratepayer have the ability? Would a developer have the ability? Would a citizen, just an ordinary citizen? All of that, frankly, is left unanswered because we have enormous body of common law that answers those questions.
Member.
Thank you. So I appreciate that answer too, because that does go to some of the commentary that's come to me on the authority of jurisdiction of who has the ability to apply to the courts, I guess, in this case, for a judicial review. And I appreciate that the minister's also acknowledged that this could be a ratepayer or a citizen of a community, because as we were talking through this yesterday, part of the narrative that we had in this House is, this is all about the citizens, in essence. Putting a piece of legislation forward to try to solve an issue where, in the sense that we are not getting the housing supply that we need. But in saying that, as the minister will recall yesterday, there was discussion around the implementation of OCPs, zoning changes that will directly affect, in some cases, positively, and in some cases maybe negatively in the perception of the homeowners, it could be affecting them. So appreciate when we talk about the judicial review. Now, listening to the minister's commentary on that as well, it sounds like there is a substantive amount of case law when it comes to the determination of whether it meets the test to go forward. And so I will acknowledge to the minister's point that with this bill, we're in new territory. Case law is not new territory, but in this bill, we'll be in a situation of, I guess, later determination, depending on how a piece of whatever is done by a municipality or the government could be perceived as something that would negatively affect somebody, and so put it into the position where they could apply through the court system for judicial review of that decision. So I really appreciate a little bit of that clarity, but I guess in the process of putting this together, I'll look at it this way. I'll ask this question. Is this common in legislation to have a section around the regulations for allowability for judicial review on a decision? Is this a very common practice in all legislation? Because I've read a lot, but because this is not something that is in my wheelhouse per se, it's not something I'm familiar with completely. So is this common practice in legislation, or is it specifically put into this one for a reason?
Minister.
Thanks very much. It is increasingly common to provide the standard of review. I'll give you, the member, an example. We have dozens and dozens, as all jurisdictions in Canada do, of what are called administrative tribunals, regulatory bodies, the Environmental Appeal Board, the regulation of oil and gas, statutory decision makers galore. And those tribunals have their own statute now. It was enacted under the former government. It's called the Administrative Tribunals Act. And if you look at that statute, it says for all judicial reviews of all of those tribunals, here are the standards of review. Here's where it's correctness, here's where it's patently unreasonable, etc. So they give guidance to all of those tribunals, and therefore when you're amending the Forest Appeals Commission legislation, you don't need to indicate what the standard of review is. You've got a place to go, one-stop shopping, called the Administrative Tribunals Act. And I commend the former government for that practice, for putting it all in one place. This, therefore, is not an administrative tribunal, as the member will know. It's a decision-making on a very specific issue, and therefore, I believe that the process here tracks very nicely the standards of review found in other legislation.
Member.
So in the case of a Housing Supply Act, in this case, there was a determination that this wording and language needed to be part of this bill. Was there discussion then? Is this put in, and this will be, I think, important to just for the House and for others, is this clause put into the legislation to protect local government, or is it in there to protect the provincial government? Is it in there to protect the ratepayers, or in essence, I guess, really all of the above when decisions are being made and people want to apply?
Minister.
The section in question deals with the decisions that the minister makes, or the cabinet makes in the case of an order in council. And so I'm not sure who it's protecting or otherwise. It's simply saying that the public has every right to take those decisions that are made, if they feel aggrieved by those decisions, to a court of law. And it simply says, here's the standard of review that court will take into account. So I don't think it's a question, to use the member's terms, of protecting anyone or otherwise. It's just providing clarity. It's first of all acknowledging that like every other government decision, the minister is subject to account in a court of law if they make errors. And the court will put them right if they do. And it's to say, it's to be silent, as we said in an answer to an earlier question, as to who gets to take the minister or the cabinet to court. Normally the courts will say they have to be a person aggrieved, not a mere busybody. Those are the kind of standards that over time have evolved, but I wouldn't want to suggest I have an answer to every single person in the community who might want to take a run at a government decision like this. The closer you are to the action, the more likely you are to have standing. But the standard of review that's here is quite typical. I'd invite again the member or his colleagues to look at the Administrative Tribunals Act, passed by the government party opposite when they were in government, and I think you'll see this is very similar. It was put in by lawyers in order to ensure that we had some kind of consistency with how judicial review would occur.
Member.
Thank you again, and appreciate the minister's time to just make sure that we canvass this. It's important just for clarity for those that are not, I guess, lawyers or who are maybe not been through this process before, because this, as we see in almost everything, when there's changes, it brings out the questions and the uncertainty of what does this mean and how will it affect me as an individual going forward when government's making decisions that could impact my life in some way. One of the, and the minister can use past experience maybe for this too, one of the things that's been raised and flagged as a concern that came to me that I want to consider on this is not so much the decision for having a judicial review process available. We've canvassed the importance of that and the reasons why, but more of the backlog that we already see in the court systems. With the minister's experience, and maybe there's a different process for something like this, so a judicial review, what kind of timelines do we look at that the minister might be able to share through his expertise or experience on this, from when somebody applies for a judicial review to the time a decision's made, whether it's erroneous or patently unreasonable, to yes, there's a willingness to actually hear the complainant?
Minister.
I thank the member because that is a very real concern. Justice delayed is justice denied. And obviously our courts are struggling post-pandemic with delays. I can give the member some comfort, though, that the nature of a judicial review is normally, first of all, does not require a trial, does not require witnesses and evidence presented orally. It's normally done through affidavits, sworn statements. It's more about questions of law once you have those facts before the court. And it's normally done on a motion in chambers, and then it's assigned to a judge. And in my experience, the judicial review can occur very, very quickly, and the courts you can get into court on these much more quickly because the registrar of the court doesn't need to set a long trial date, such as it might be the case if there was a personal injury or something. That is where delays may occur. But I can give comfort to the member that normally judicial reviews are done on a relatively expedited basis.
Member.
Thank you, and I appreciate, again, as we canvass this, because this, I guess, somewhat not necessarily jokingly say I've had the privilege of not having to go through a judicial review and decisions that I've made in my time in almost 20 years now in government. So I don't have the experience of that process. So I appreciate the minister explaining that to the House. One of the questions, I guess, that arises through that commentary is what happens in the meantime while we're waiting. And by that I mean, when we looked at examples of when we might go through a judicial review process, it's because when somebody, let's just say somebody feels that they have been wronged in some way, whether it's a municipality or a citizen, stakeholder, and so they seek the opportunity for a judicial review. My assumption is obviously the decision that has been made, whether it's been an order by the minister, whether it's been a directive, something that the advisor has put forward. We'll use those as examples for now, and I know there'll be a multitude of different conceptual ideas that might happen depending on the situation, so we can't be prescriptive on an exact example. But in a situation like that, I assume what happens then is any decision is now on hold. And so when we're working about trying to move housing forward, and we talked yesterday about, some of this stuff will be a couple of years down the road as we go through this process that this bill is highlighting. But if something's now under a judicial review, and the minister has said through experience that, these can move fairly quickly, but I guess the assumption is if I as a citizen don't agree and I apply for a judicial review on a decision, that decision is now considered on hold pending the judicial review. So could that create, I guess, an unintended backlog on some of the decisions that we're trying to make?
Minister.
It's difficult to answer the question without the context of the judicial process in mind, but normally the court has the ability, if it's a frivolous case, to say that under the rules of court, that it does not disclose a reasonable cause of action. So if a person comes in and makes what I might characterize as a frivolous case, the courts have long-standing remedy to kick it out immediately on a chamber's application and there'd be no delay whatsoever, if that were the case. If it does disclose a reasonable cause of action, the minister's lawyers would don't want to get it heard on an expedited basis, so we can get it done and not cause the delay that the member fears. There's full authority for courts to accept a motion to move it on to the trial list or to the chamber's list on an expedited basis so it can be dealt with. The good news about judicial review, as I repeat, is it can be done on a fairly expedited basis as compared to other things that would go to the court. And I point out to the member that this all is done in the Superior Court, not the BC Provincial Court. It's all dealt with in the BC Supreme Court.
Shall Clause 17 pass? Aye. So ordered. Shall Clause 18 pass? Aye. So ordered. Shall Clause 19 pass? Member.
Thank you. Don't want to spend a lot of time on this, but just Clause 19, or Section Clause 19 is talking again about our advisors. It's fun. It's interesting on a follow-up, and I know these are not directly put in sequence when we put a bill for any, as we canvassed yesterday. It's not necessarily, it's the legislative scripters that actually put things in a certain order for a certain reason. But it is interesting when we just finished talking about judicial review, and then Clause 19 actually talks about the immunity for liability for advisors. Can the minister maybe explain why this section was required? What was the thought process of why we put this in here?
Minister.
I anticipated the member might ask this question. It's an excellent question. And as to the placement in the bill, A, it's a drafting convention. That's where they put it. And B, I would say the things we're talking about now are ancillary to the main event. The main event is the orders, the targets, all of that. So we're at the tail end of the bill for anyone who's watching, and these are merely ancillary provisions. But this is an important one. A public servant who is sued for his or her work has normally got either immunity or an indemnity. An indemnity is where if I sue the public servant, the state will stand behind them and look after their expense. But they still have the uncertainty they may have to go to court. And there's anxiety and all of this that goes along with it for a person who's just doing their job. However, what if I hire somebody, the other way of doing that, rather than leaving them with that uncertainty, is for which they'll be indemnified, is to say from the outset, we're going to say you have immunity from lawsuits. So we avoid that uncertainty. You're getting to the same place. You're not going to have to pay for whatever the damages are or whatever, but we're providing immunity to that public servant. And now we get to the meat of the member's question. If you're not a public servant, and of course an advisor can be a public servant, but you're somebody who is from an accounting firm, to use an example the member used yesterday, who has expertise, and they're doing a job for the minister in good faith, trying to get to the bottom of why there are delays and we can't get housing built in a particular municipality, then this section is intended to provide immunity to that person so they can take the job on without fear they're going to have to deal with a court case later on for which they'll have anxiety, etc. If there's bad faith, that's a different situation, but in the normal course of things, you will have statutory immunity because after all, it's the minister who should take the heat because it's his or her decision that's at play. This is merely a person advising that minister as to what should be done.
Member.
I appreciate that. It's interesting when the minister, he used the word bad faith. I mean, obviously, in good faith, we want to ensure that the people that are chosen as advisors, et cetera, are experts in their field for whatever the decision has been made by government where an advisor is required to go in to a municipality to assist them in the decision-making. So maybe the minister can explain then if the indemnity aspects was talked about, and if we're trying to make an advisor, whether it's in-house, out-of-house, immune from liability, and I'm just trying to, as I've been glancing at the wording, it's not a very big clause, it's only 2 sections within that clause. Where is the ability then? We don't want to say somebody will act in bad faith. I don't want to say that will happen. But where is the accountability measures then? Where does that lie if they are immune from liability?
Minister.
And I'm happy to report that very question was in clause 19 sub 2. The first part of the clause says immunity protection for the advisor is provided for any work done in exercise of that power. But subsection 2 makes clear that that doesn't apply to anybody for anything done or omitted to be done in bad faith. So if it's bad faith, that changes everything. And they would still face, there would be no statutory immunity for a person who is found to have acted in bad faith. That's what subsection 2 says very clearly.
Member.
Yeah, thank you. And when I was reading that, and I know the minister used bad faith, and that's because that wording is very prescriptive right in the legislation, as the minister just read out in clause 2 there. I guess my thought was, when we were talking about sticks for everybody else, what's the mechanism for the advisor? So, as the minister said, they're immune from liability unless they've acted in bad faith. Basically, I'm paraphrasing or the discussion we just had. So what are the tools then? So I guess, that's just what I wanted to get on the record then from the minister's perspective. So if an advisor is chosen and it is decided that for whatever reason they did not do the job, or they acted in bad faith, obviously that's never the intent. We hope that would never happen. But I know when we're doing legislation, and especially within the legal parameters that we're trying to put together in legislation, that every I is dotted for circumstances. But where is the jurisdictional aspect that comes in for the minister if somebody does act in bad faith, to ensure that, is it just a mechanism of your contract's canceled, you're immune under this act, but we're getting rid of you or just bringing in somebody else because you acted in bad faith? Or is there at least some criteria to hold these people accountable?
Minister.
The minister will always be accountable. And if that person acts in bad faith, they have no protection under this bill. They can be held to account as an individual. Bad faith unravels everything. And I think that's what the point of this is, to clarify.
Member.
Thank you. Thank you, Chair. As we just finishing off here on section 19, I appreciate again the minister's answer, because obviously one of the main concerns that I was hearing from some local governments is, just to maybe wrap up this section again, was the fact that the last thing we want to see is an advisor brought in that has no accountability measures built in to the work that they have to do when they're scrutinizing, criticizing the ability of the local government, because they themselves want to ensure that everybody in this case is acting in good faith. So on this section, I'll just, I know we only have a few minutes left till we'll be having to move forward, reporting out from other houses. But on this section, I'll just wrap up there by just saying I appreciate the commentary that the minister just gave. That will help some of the questions from local government that came to me, especially again around the accountability aspect, because we're putting all this accountability on local government, and they just wanted to make sure that everybody else is being held to the same standards that this government is asking them to stand to.
Minister.
My colleague, that's exactly the theory of the legislation, and I hope the practice.
Shall Clause 19 pass? Aye. So ordered. Shall Clause 20 pass? Aye. So ordered. Shall Clause 21 pass? Member.
Yeah, but it will soon, I assume. Clause 21 is the very last one when we're talking about coming into force and commencement. I just want to, I know interestingly, the way this has transpired over the last 10 hours, I guess, or whatever it's been of discussion as we bounced around between different sections. I think we were on section 1 and we talked about section 21 when we were talking about commencement and the time that we're talking about from this bill coming into effect. Since we're actually on that section for Hansard, can the minister again just remind this House why the decision was made that we have to wait for possible regulations, why we have to wait for commencement to come in through order in council rather than coming in on royal assent, which we hear will be sometime this afternoon. We are in a housing crisis, as we've all said in this House, and again, we want to move forward with things as quickly as possible if we're trying to recognize the crisis that we're in. So maybe the minister can just remind this House again of why we're waiting until next year.
Minister.
Well, I share the member's impatience to get on with it. I agree entirely that we have a crisis, and this is one of the many tools that we need to bring to bear to address that crisis. To answer the member's question, the expectation that would be that the bill would come into force in April. And the reason is we need to, in some cases, probably hire staff, ensure we have the advisors on hand who could help if that's needed. But more importantly, most importantly, to make sure we have talked to we begin the dialogue with the Union of BC Municipalities and deal with the analysis of the housing needs reports and statistics, etc., to get the first cohort identified and then to consult with the municipalities thereafter. We're standing up an entirely new regime, as a member has said, an entirely new system, and so we need to get it right. And we want to do it because so much of our effort is to collaborate with local government. We hope, as I have said, never to have to use some of the compliance tools that the member has been discussing with us earlier. And if I may, because this may be the last question, I can't anticipate that the member asks. I just want to thank him for his careful analysis of the bill. It served us all well, and I appreciate it very much.
Member.
Thank you, Speaker, and thank you to the minister again and his staff. It's been very informative, the discussion that we've had over the last day and a half. It does, and I don't want to take time on this, but it does remind me again, and I have to comment again how disappointed I was that when we heard yesterday that this bill had actually started being discussed last June, that it took to the last week of session with only a couple of days left to bring the bill forward. Nobody is arguing the importance of making sure we move forward to get the housing supply that we need. Obviously, the discussion that we've had in the past and some of the discussions and commentary that's been in this House that we were opposed to was the fact that members weren't afforded the time in second reading to really bring forward the comments that they wanted to do as respected members of this House, elected in this House to have commentary and to rush forward a piece of legislation without affording the time for that scrutiny for all members. I do appreciate, obviously, the time I've had in committee stage, which has been very important, but that should not take away from the fact that second reading was forced to close, not allowing other members the opportunity and the ability to speak their mind. So I'll just end by saying that this is an important piece of legislation I will acknowledge if it works. My concern is, I don't want to use the analogy of too little too late, but there's been housing supply needs that have been out for about 5 years. We've seen this housing crisis escalate to a point where it is a massive crisis. We've seen inflation, we've seen cost pressures, we've seen lack of housing being built because of all of those. I don't see, with all due respect to the minister, I don't see this being some iconic piece of legislation that's going to be solving the housing crisis. And if this is the one that the government sees fit to rush through the House on the first week of the new premier as something that's going to solve the housing crisis, I don't see it. I don't see this fixing something. We've acknowledged that it's an important piece to try to acknowledge where some of the backlog might be, but we've also canvassed the fact that this is going to be years more before we will maybe start seeing some kind of coming to fruition by whatever this happens to bring in. I do want to say again and acknowledge, because the concerns that I've heard from UBCM and others, that there could be unintended consequences. The minister and the new Minister of Housing, whoever that may be, I think needs to be alive to that, and encouraged to hear they'll go through that consultation. As a former mayor, we need to make sure we're doing that. But again, we need to fix this housing crisis. This might be a little piece of it, but I don't think it's going to be the silver bullet that some people out there are trying to proclaim that it will be.
Minister.
Well, thank you very much. And in the sense that were, I presume, sort of the concluding remarks of my friend across the way, I'd just like to say, again, thank you to him, through you, for the thoughtful and thorough review of the bill that's taken place. We disagree on the importance of this bill, I think. I consider it to be a tool, but only one tool in the toolkit that we all have to apply if we're going to tackle the housing crisis head on. I can, contrary to what the members suggested, I can tell you that so many validators have come forward to express happiness with what this bill they consider will do, such as Michael Geller of the Geller Group, saying very much, I like one of the pieces very much, and that's the incentives or encouragement that's proposed to give to municipalities to achieve certain targets. I think that actually is going to be very beneficial and will result in significant increases in supply, both for the market and especially non-market projects, close quote, CKNW, November 22nd. So people who are in the business, the day-to-day business of trying to get housing out the door, see this as a critically important tool. We do too, and I hope that the government, a party across the way, will see fit to support this on third reading. Thank you.
Thank you, Minister. Shall Clause 21 pass? Aye. So ordered. Shall the title pass? Aye. So
on the title? On.
Shall the title pass? Shall the title pass? Aye. So ordered. Minister.
Thank you, Madam Chair. I move the committee rise and report the bill complete without amendment.
You've heard the question. All those in favor? Aye. All those opposed? Motion's carried. Division has been called. Members, could I have your attention, please? Order. I'd like to advise members that it's inappropriate to be speaking to people in the gallery, and I would expect that there would be decorum in the chamber. Thank you. Members, the question is that the Committee on Bill 43 report the bill complete without amendment. All those in favour, please rise. Thank you. Thank you. Could I please have order? Order in the chamber, please. As happy as you are today, we'll ask the clerk to canvass those. Apparently, I have to ask those voting nay. Madam Clerk?
And those online, Minister Chen.
I vote aye.
Thank you. Mr. Davies.
I vote aye.
Thank you. Thank you. Mr. Routley.
I vote aye.
Madam Clerk?
Nemine contradicende.
Just a second. Committee Chair.
The Committee on Bill 43 reports the bill complete without amendment.
When shall the bill be read a third time, Government House Leader?
Speaker.
The question is third reading of the bill, 43, Housing Supply Act. All those in favor indicate aye. Aye. Opposed? Motion carried. The motion for third reading bill number... Oh, division. Members, may I ask if the House agreed to waive the time? Aye. Thank you. Madam Clerk. Madam Clerk. Okay. The question is third reading of Bill 43, Housing Supply Act. All those in favor say aye. Aye. Opposed? Motion carried. We already did it. All those in favor say aye, or please rise. Or indicate. Thank you. Please be seated. All those who vote nay, please rise or indicate. Motion carried. Oh, it's the last day.
Minister Chen.
I vote aye.
Mr. Davies.
I vote aye.
Mr. Routley.
I vote aye.
Nemine contradicende.
say, right? The motion for third reading of Bill number 43, Housing Supply Act, intituled Housing Supply Act, has carried and the bill has passed. Committee Chair.
Mr. Speaker, Section A reports progress on Bill 38 and asks leave to sit again.
When shall the committee sit again, Government House Leader?
Next sitting.
So ordered. Committee Chair. Committee Chair.
Mr. Speaker, Section C reports progress on Bill 36 and asks leave to sit again.
When shall the committee sit again, Government House Leader?
Next sitting.
So ordered. Government House Leader.
I move the House now adjourn.
Members, you heard the motion. All those in favor indicate aye. Aye. Opposed? Motion carried. This House stands adjourned until 1 p.m. this afternoon.